However, his wife gave him an ultimatum. If he did not find someone to talk to, she was out. Did I tell you about the military veteran who reluctantly came to me for therapy? I mean, this guy had already gone to the Veterans Administration, which we call VA, and he hated every moment that he had to discuss his past. However, his wife gave him an ultimatum. If he did not find someone to talk to, she was out. So that is when he agreed to meet with me. The story starts with a military veteran whom we will call Jim. Jim claimed to be a former military veteran, and he believes he has PTSD, post-traumatic stress disorder, and does not understand why he and his spouse do not get along. By the way, we will call her Stacy. Now, you should know, Stacy is the one who called me on behalf of her husband, Jim. Now, Jim and I have never met, and until he and I actually talked, all the information I was able to learn came from Stacy. Yes, I understand, one-sided truth at this point. Anyway, I eventually met with Jim, and we talked about his military career and how he did this and he did that. His attempts to impress me were futile. Now, if you have been following my channel, you know I have talked about my background and how I was actually in special ops with the U.S. Army with a unit called Airborne Rangers. Some of you may be familiar. So I know a thing or two about being in various conflicts that are not always public knowledge, or the type of training we do. So interestingly enough, Jim has a lot of stories he wants to share. I guess he felt that he needed to impress me. He wanted to show how he does not need therapy, and he is just doing this to make his wife happy. Now keep in mind, when we met, we took a long walk in an old neighborhood of his, and we walked, and talked, but he actually did all the talking as we walked and walked. By the time we returned to our vehicles, which I recommended we do after I found myself both mentally and physically exhausted. It had been over 2 hours of him talking. I think I had about 5 to 7 questions within that entire time. Now, as a therapist, it is always important to listen more than speak. But as I tried to guide him in the direction of purpose, he insisted on trying to impress me with his background. So I made a mental note of this. Later on, his wife Stacy calls me and asks about how it goes. I recap the session, so to speak, without giving her specific details about what is confidential between him and I. She was very pleased that he actually showed up, but insisted that she still wanted to go forward and hire me for herself. I asked why, and she stated that at the end of the day, she was going to leave him just the same, despite him coming to therapy. She wanted to, 1, keep this private, and 2, understand how she could navigate the divorce with a man who is both abusive and mentally ill. And she wanted to avoid any serious repercussions in the process. I accepted her as a client, but only to help her understand how to read and understand mental challenges, not to discuss her husband. Here's the thing about Stacy. When she met Jim, she was a bodybuilder at their local gym, and he actually frequented, and according to both of them, quite a few men attempted to capture her attention. Obviously, they all failed, where Jim did not. But during their dating, Jim showed controlling, verbally and mentally abusive behavior on and off during their dating process. She ignored these red flags and married him anyway. That was 12 years ago. I continued to work with Jim, and we had established an improved and trusting relationship. The interesting thing that evolved throughout his therapy was not that he had PTSD from the military. Nope. I was able to learn that he actually had challenges stemming from his childhood. As I inquired more and more, I started to identify a pattern in his attempts of trying to achieve success. You see, the stories of his military service were not because he wanted to bond or share his background with me. He was justifying his failures and needed me to understand the reasoning before I even started to understand what he felt, and he feeling judgmental. Apparently, he failed at attempting to achieve a lot of different statuses within the military he desperately wanted to accomplish. And that opened up doors for me to ask, why?
I want to thank the sponsor, Crank Golf, for supporting the series about sports performance and managing your mental health. Because of sponsors like them, we're able to keep things going and keeping topics fresh. If you want to support this page, please just click subscribe and click the bell so you can get updates on the next topics. Thank you again.
Why was this so important? He was clearly showing signs of anger, frustration, depression, and taking it out on his spouse. His verbal outbursts, his body shaming of her, his complaining about minor problems, his avoidance of communicating, his anger towards others. I was able to see the source was stemming from his abusive father, who was someone in a role of respect and authority. His degrading mother, who had to deal with this same abusive husband and took it out on Jim during his upbringing. And apparently, Jim had interaction with his grandfather, who was no better with the addition of alcoholism that was passed down to his father and to him. That was until Stacy insisted that he get sober some years back. Well, at the end of the day, Stacy and Jim are still together. I have not been working with Stacy anymore, but I have left her with a new understanding. I explained to Stacy that PTSD has various levels of challenges, and as a military spouse, this role comes with responsibilities. Responsibilities to understand and assist her husband in navigating himself into a mental peace. It is not easy for either of them. I explained that she is his foundation, and although he cannot explain it, nor did he even know or understand it before I even worked with him, I also explained that she is a stability he needs, and his performance as a husband, although not acceptable, she is keeping him from sliding into a mental state that could be much worse. Over the years, I have explained to so many others. Most people claim PTSD because the word covers so many different levels and tiers of emotions. However, the specifics are not clear, especially if the person has prior military, law enforcement, or has had any level of traumatic experiences. You see, there are times when the source of mental challenges can stem from much further back into a person's past. That will put them into a spiral situation if the person or family or friend does not seek help. So like Stacy, seek assistance, have a plan, and stay strong. My name is Dr. Bryant, and this is the Mental Blueprint. Thank you again.